Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good day. I hope you are doing great and be fine, and of course ready in front of your device, no matter what it is, laptop, PC, handphone, tab, or whatsoever. Okay, before we proceed, I would like to take this great opportunity to congratulate each of you for being selected to further your studies here, and welcome to Faculty of Science, no matter from which department you are in. And before that, let me introduce myself first. My name, as you can see on the slide itself, my name is Nazrul Hakimi bin Rahmat. I am the science officer at Department of Chemistry at this faculty. So, without further ado, let us proceed to our slot today entitled First Aid and its use. Okay, this slot will only take about 30 minutes, so that please stay tuned, stay alert, and don't go anywhere. Okay, what is first aid? Okay, what do you know about this first aid term? Okay, when we talk about first aid, what is the first thing come into your mind? Okay, first aid is an immediate treatment or help given to the person at the place of incident before arrival of the medical personnel or ambulance. Okay, why we need first aid? Okay, does anybody able to give a first aid if anything bad happen within us? Okay, normally people in an organization will undergo specific training at specific hours to be fulfilled and also take exam on it. Okay, if they pass the exam, they will be awarded certificate to be the first aider. But never mind, if you do not have any certificate, doesn't mean that you are banned from doing anything when something bad is happen around us. Okay, that's why we include this topic during this LSC so that you are aware how to reflect when an emergency occurs. Okay, so back to this slide, why we need a first aid. Okay, the first one, to save the life of people around us. Okay, no matter where we are, at home, office, when we are going for travel and whatsoever. Okay, number two, to reduce the pain. And number three, to avoid the condition become worse. Okay, this is very important. While waiting the medical team arrive at the incident area, we can help the casualty by stabilizing them, stop the bleeding, cover the wound, and whatsoever. Okay, why we need first aid? Okay, number one, to save the life. Okay, how to save the life? Okay, by doing, there are three things that I listed down here. Number one is CPR. Okay, look at the diagram, number A. Okay, that is the CPR. Okay, number two, by stop the bleeding. Okay, it may comes from the cuts. Okay, but how to stop the bleeding? Okay, find the clean cloth, put it on the wound, and give pressure to that area so that the bleeding will be less, and if it can be stopped, it is very good. Okay, number three, by avoiding or recovering the shock. Okay, remember, every minute counts. Okay, every minutes are very important to save the life of the casualty. The late action might endanger the casualty, and even worse, the person may die while waiting the paramedic. So please be brave and help whatever you can do. Okay, first aid is an immediate treatment. You have to remember this. Okay, then next, why we need the first aid? Number two, to reduce pain. Okay, how to reduce the pain? Okay, by giving, okay, A, treatment on the injuries. Okay, B, by giving the emotional support to the person. Okay, how to do this? Okay, do not leave the casualty alone. Remember, be brave. While be with them, please communicate with them so that we can avoid them from being shocked. Okay, normal scenario when we encounter this emergency situation. Okay, most of us try to avoid the scene area, right? Because of the fear and any other reason. Okay, please. Okay, that's why related knowledge is very, very important. Okay, if you are given opportunity to learn further about this, okay, please take the opportunities, go and attend the course. Okay, you will be lost nothing. And even more, you can use that knowledge to help people near you, include your beloved one. Okay, see, next, please make sure the casualty is stable. Okay, how to determine that they are stable? First, please put the casualty in recovery position. Let's say if a worker in the factory accidentally cut the wrist, what you have to do? Okay, treat the wound, put the cloth, put the plaster on it, then put the triangle bandage, and make sure the hand is higher than the heart position. And then next, observe the breathing. Of course, it is very important. Okay, and also please check the pulse by putting your hand on the wrist or put your hand near the neck and etc. Okay, so why we need first aid? Okay, number 3, to avoid the condition becomes worse. Okay, how to avoid this? Okay, number 1, by reduce the movement. Put them stay still at the position. Avoid moving the casualty from one place to another place. If you think there is any fracture, please splint that area. Okay, put straight and put hard object when doing splinting. Okay, protect the casualty. Number 3, protect the casualty from any harm. Let's say there is accident occur in front of your house. Okay, in front of your house, and that is the main road. Okay, the cars are from here and there. Okay, to avoid the car hit the casualty, you may at first control the traffic. Okay, or maybe if it is still if it is raining or very hot sunny day, you can provide umbrella wherever suitable to the situation. Okay, number 4, please bear in your mind, do not give any food or drink to them. Okay, do not give any food or drink to them. If the lip looks dry, you may just wet the lip if this is still necessary. Okay, please remember, okay, first aid treatment is just temporary. Okay, not a permanent procedure. If the case is serious, please send them to the nearest clinic or hospital, or maybe you can contact ambulance so that they can examine that person for further details. Okay, but if the one is just a small cut, you may just treat by your own self and monitor the situation from time to time. Okay, so this is the first aid kit. Okay, to make this kit easy to identify, the color normally a combination of red and white. Okay, so that from far away also we may identify this kit. Okay, within our compound, normally we will put each lab one of it. Okay, so next few slides I will show you one by one what are the things inside that first aid kit. Okay, refer to this slide. There are 3 things that I listed down here. What is inside the first aid kit? Number 1 is cotton bandage. Okay, this will be a different size, starting from ½ inch, 1 inch, 2 inch, and also in 3 inch. Okay, this cotton bandage is using for bandaging and also for tying. Okay, number 2 is the cotton. Okay, this is the cotton. You may refer to the picture on this slide. Okay, on your right hand side. Okay, we use the cotton for wound cleaning and dapping. And next, the last one is the gauze. Okay, we use the gauze to cleaning the wound and covering the dressing. Okay. So next slide I will show you another 3 things that will be in the first aid kit. Okay, number 1 is antiseptic lotion. Okay, there are a lot of antiseptic lotion in the market, such as Savlon, Dettol, etc. Okay, this antiseptic lotion we use for wound cleaning. Okay, number 2 is the antiseptic. Okay, such as the Flovine. Okay, we use this antiseptic for faster the wound drying process. Okay, and the last one is a plaster. The type of the plaster normally in a micropore surgical tape. Okay, we use this plaster to holding the dressing. Okay, So next slide, I will show you another 3 things inside the first aid kit. Number 1 is a resuscitation mask, one-way type. It might be if there is no resuscitation mask, okay, normally first aid kit will include the pocket mask or the face shield, okay, either one of it. Okay, we use this for CPR. Okay, CPR. What is CPR actually? Well, we normally heard about this CPR, but some of us doesn't know what is CPR actually. Okay, CPR is a cardiopulmonary resuscitation. Okay, not the respiratory. Okay, I asked my friend before, what is CPR? R means for respiratory, but it is not the correct answer. Okay, the CPR is actually the cardiopulmonary resuscitation. Okay, next is the crib bandage. Okay, normally there are four rollers that will be put in the first aid kit at the different size. It's either 15 centimeter width, 10 centimeter, 7.5 centimeter, 5 centimeter. Okay, this crib bandage, of course, we use it for the bandaging. Okay, and the last one is the handy plus. This is the common thing. Okay. Handy plus we use for to cover the small wound. Okay, next slide, I will show you another 3 things that will be in the first aid kit. The first one is triangular bandage or kain ando. Normally the size will be fixed at 130 cm times 90 cm times 90 cm. Okay, this triangular bandage we use it to cover the wound and for tying. Okay, next also we'll put the scissor in the first aid kit to doing the cutting process, and the last one is the glove. Okay, the disposable or non-sterile glove we will put in the first aid kit also. Okay, this glove we will use to avoid cross infection while doing the treatment. Okay, so next is the another 3 things that will be in the first aid kit. Okay, forceps to hold the cotton and gauze for dressing. We also can find the eye shield. Okay, this eye shield to protect the eye, and also the eye pad. The function is just the same, to protect the eye. Okay. Okay, next is the safety pin. Okay, this safety pin to hold the arm slings and bandages in place. Next is the plastic bag to put the clinical waste on it. Okay, and the last one is the paper and pencil to jot down any notes necessary during the event if necessary. Okay. Okay, as an additional to that, for the first aid treatment, we also use the ice cube. Okay, this ice cube is for cold compressing in order to reduce pain, swelling, and bleeding. Okay, number 2, we also use the ethyl chloride spray. We normally use this spray in order to reduce the pain related to the sports injury. Okay, we just spray this ethyl chloride at the affected area, and normally the pain will reduce accordingly. And last but not least, the spin. The spin. Okay, we use the spin if there is any fracture. Okay, you can refer the picture above here. Okay, there is how the spin looks like. Okay. So next, this is the table of the different contents between type of box. Okay, look at this slide. Okay, this slide mentioned the different contents between type of box. Okay, look at the table here. If you can see, there are 3 box listed here, named as box A, box B, and box C. Okay, each of this box will include different numbers of contents. Okay. Okay, for example, we look at the crib bandage 10 cm. Okay, for the box A, only one will be put in the first aid kit. Okay, for box B, we put it 3 crib bandage 10 cm, and the box C, we will put a 6 creep bandage on the first aid kit. Okay, why this is different between box A, box B, and box C? Okay, it is because the box will actually reflect the numbers of the person in one certain area. Okay, look at the table. If the staff is about 25 packs, we just need one box A only. Okay, if there are about 50 staff, okay, in that area, it either one box B or two box A. Okay, and if there are about 100 staff, we need either one box C or two box B or four box A. That's why the difference of the contents differed between box A, box B, and box C. Depends on the how many staff in that area. Okay, so that we may use this table to identify how many first aid kit needed at one place. Okay, so ladies and gentlemen, we will have a short break right now to give the time for QR code to be appeared on your screen for the attendance purpose. We will continue right after this. Okay, let us continue. Okay, before we have a first aid kit, we need to know the criteria of that first aid kit. Okay, first, the first aid kit must be easy to carry around. Okay, the heavy and bulky one is not the first aid kit because we cannot carry it easily. Okay, number two, the label of the first aid kit should be clear enough and may aware others about the presence of the kit itself. Okay, the location where we put the first aid kit should be prominent, easy access, and at accessible position. Do not place the kit too high and not too low. Okay, remember, always lock the kit. Okay, the key should be kept by the trusted personnel. Okay, why we need to lock the kit? The uttermost reason is because of the monitoring and safety purpose. So next, we will look on the content of the kit. Okay, please remember, number one, do not keep any oral medication, okay, such as Panadol, Eufamol, and so on. It should place outside the box, not in the box. Okay, that is number one. Number two, please monitor the kit. Do the stock tick once a month at least. Okay, if there is anything that has been used, please replace them immediately. Let's say you already take out the cotton and goes to treat the wound. The one who monitor need to take fast action by replace them. That's why stock tick is very important. Okay, for monitoring purpose. Okay, when we are doing stock tick, what exactly you have to do? Okay, check if it is complete or not. If not complete, okay, please replace soon as possible. Number two, check also the expiry date. Make sure we alert the expiry date written at the box or at the bottle, not the expiry date on the stock tick card, so that when we are doing monitoring, we can identify those will expire soon and replace with the new one. Okay, next I will show you a method to treat the strain if this is happen. Okay, we call the technique mentioned here as RICE. Okay, RICE. Okay, R stand for rest, I stand for ice, C stand for compression, and E stand for elevation. Okay, for the R rest, what you have to do to treat the strain, by stop any activity that causes pain or soreness, okay, by resting or immobilizing. Okay, next for I stand for ice. Okay, what you have to do is apply an ice or cold pack to minimize the swelling. Apply this about 10 to 20 minutes, 3 or more times a day for about 48 to 72 hours. Okay, number 3 is C, compression. What you have to do, wrap to decrease the swelling. Okay, don't wrap it too tightly. talk to your doctor if you need to wrap it longer than 48 to 72 hours. By using what? By using the crib bandage. Okay, and E, the last one, elevation. What you have to do? By elevate the injury while applying ice, and anytime you are resting, try to keep it above the level of your heart to help minimize swelling. Okay, since we will be in the laboratories in next few years for doing laboratory research and final year project, I will bring to you how to handle if a chemical gets into your eyes. Okay, what is the first thing you should do? Okay, first thing first, please tilt your head so that the injured eye is on downward to prevent the chemical to run into the unaffected part. Okay. Number 2, please keep the eye open gently with your fingers and rinse out the eye with cool running water or tap water about 10 to 15 minutes. And then I would like to suggest to you to check the condition at the nearest clinic or hospital. Okay, next we will go on the treatment if there are burns occurred. Okay, this diagram shown how to stop the burning. Okay, this is the first aid for burn. Okay, we use the stop technique. S stand for strip hot clothes and jewelry. T to turn on cool tap. Okay, never use ice. Okay, run burn under cool water for 10 minutes. Keep the rest of the person warm. O, organize medical assistance. Okay, by contact the unit bantu mula or 999 or whatsoever. Okay, and the P is stand for protect. Okay, to protect burn with a clean film or clean cloth. Okay, but do not use dressing, fluffy cloth, creams or lotion. Okay, while you are doing the burns treatment. Okay, next I will show you how to treat abdominal wound. Okay, this might be rare to be happen, but if this is happen, okay, the first thing first, what you have to do, lie down the casualty. Okay, number 2, bend the knees and loosen the clothes. Number 3, dress wound with wet clean towel. And the last one, cover the casualty with blanket. Okay. Okay, next I will show you the treatment for amputated wound. Okay, there are 4 steps of the treatment of this amputated wound. The first one, by cleaning the amputated area. Okay, next, stop the bleeding by putting the direct pressure. Cover the wound with a sterile dressing or clean cloth. And the last one, elevate the wound. Okay, this is the step for the treatment of amputated wound. Okay, so next this slide will show you the treatment for amputation. The first one, please put the amputated body inside the ice bag. Okay, please remember to not clean the amputated body. Okay, and then do not also put the amputated body direct to the ice. Okay, you have to cover it first. Okay, and then do not cover the amputated body with cotton. Please remember this, all the do not things. Okay. Okay, that's all for today. I have nothing more to show you. Since this slot is very intensive, I really hope that you gain something from my presentation. With that, I end my session. Thank you. Assalamualaikum warahmatullahi wabarakatuh.